Hello, as the crisis deepens here on Wakra Swag, we are trying to bring you stories from across the country of people who are suffering from COVID, doctors, and also, very importantly, the reporters who are bringing us ground realities, reporters who are standing through the day, through the night as they see immense amount of cremations 24/7 around them as they see people dying around them on hospitals, bringing us the truth, bringing us the reality.
Welcome to Bakra Swag. I'm Manika Raikvar, and along with my partner in crime, Jyotsna Mohan Bhargav, every week we try and bring you stories from the ground. As Jyotsna said, today we decided to speak to reporters who are bringing us stories, the real stories, stories that we don't get from the government, stories of numbers, of data that is very often deliberately hidden and fudged. And really, in this atmosphere of fear where we're all sitting at homes, when we're all trying to keep safe within the four walls of our houses, whether it is doctors or nurses or lab technicians or policemen, reporters are those other frontline workers who are out there every day getting us what is really happening on the ground. We have with us today Mahesh Langa. He's the assistant editor with The Hindu, reporting out of Gujarat. And we have Sneha Koshy, who's the deputy editor with NDTV 24/7, and she reports out of Kerala. A huge welcome to both of you. Mahesh Langa, Sneha Koshy, thank you so much for joining us today. I really wanted to start by asking you both this story, the pandemic in India, for almost over a year now. Uh, Personally, what has this journey been like? Because, I mean, it is not an easy story to tell. It takes a lot of, I think, personal courage. And there's so many reporters out there doing it. But for you guys, out of Gujarat and out of Kerala, what has it been like? Mahesh, if I could start with you.
Okay, starting with 2020 when India started reporting cases. So in Ahmedabad, in the very first phase of pandemic, Ahmedabad was one of the worst hit cities because just before the pandemic began in Ahmedabad, we had massive congregation of at the stadium where President Donald Trump had come and and that was I think on 24th of February, and first case that was reported in Ahmedabad was sometime in second week of March. So by April end, Ahmedabad was pretty bad, extremely bad scenario last year in April. In fact, now we are the worst. We are much worse than what we were last year. So it remained that till June end, Ahmedabad was very you had hundreds of cases and sizable number of deaths. You never know the real numbers because government is not revealing the numbers, but still a large number of deaths occurred in the first phase. Then July onwards, it became quite normal. Then we had, during Diwali, during Navratri, Diwali, it was a kind of normal situation. After Diwali, yes, again, there was a spurt in cases and deaths, but again, quickly it became normal. This wave that began in the second week of March, it came like a storm. No one forget about the government, even media. We were also not prepared that Ahmedabad would be just engulfed by the pandemic in such a massive way. All of a sudden there will be thousands of cases and hundreds of deaths every day. So this wave is quite very upsetting mentally and emotionally, because you do your job, but at the same time you get calls from relatives, your friends, your acquaintances that, oh, please help, get us one bed, get us one oxygen cylinder, get us one some ambulance. In the first phase, we knew that people were dying, but not those whom from our families or from our friend circle, or this time when I wake up in the morning and see my box, now, mobile and WhatsApp every day. I mean, you just see 5 to 7 days. I mean, people whom you knew quite well, that so and so has died, so and so is his father has passed away, so and so's mother has passed away. So it's very very challenging mentally and emotionally.
Sneha, for you, I mean, Kerala, at least the first time around, everyone said, they battled it really well. And of course, the second wave, Kerala has also been hit hard. But relatively, there just seems to be a little more order. I don't know, you're on the ground, so tell us.
I also will try not to make this about me, but as a reporter on the ground, and I speak this for so many reporters who've been on the ground, it's perhaps the first time that we are reporting anything like this in our life. Whether it be verifying facts that the government is putting out, or whether it be going to locations and report, all of that has been so challenging. And when I say that, let's try and break this up. Yes, Kerala has not seen this kind of scenes that we are seeing across India. But on the ground, when we are going in, especially during the first wave, that when this had just emerged, and Kerala was one of the states which had it first time, we were going out of the ground and we were coming back home sometimes so scared. If it could be just a regular exhaustion. And if you're out the whole day, it's a hot, sunny day, and you're going into these vulnerable areas and you're reporting, you are in contact with people. Now, at that time, we didn't even know how this pandemic will pan. We did not even know what to do and what not to do. The only thing we knew was wear your mask, wear your gloves. And we would come back, and so many of us reporters have messaged each other saying, I'm feeling exhausted. I've got a throat issue. Could this be COVID? Just those very, very simple things, because we reported from somewhere and come back, and we in first phase and all, I still remember many of us would wake up in the night uh, because we feel something is wrong, and we would just be very worried that we've gone out and we've spoken to somebody who's a contact, or something like that. There were many issues that, as a reporter, many reporters on the ground have battled this firsthand. Secondly, there's another issue, and that is something, I'll give you an example. I just went to a war room the other day, and now war rooms are zones which are totally cordoned off. People are working in, they are the nurse centers. And then when you get permission to get into a war room like that and shoot, which is important for television and important for people to know that something like this is happening, it's a reassuring message that they also get. And it's also important to keep the morale for those people who are doing this high. But there's a flip side to this. You are worried that because you have been on the ground, are you making them vulnerable with your presence when you're going into those zones? And then you come back, like yesterday when I came back, again, I just felt this massive exhaustion. And obviously it could have been because I hadn't eaten anything throughout the day reporting out, which is common for reporters. Nothing great about me. It's very, very common for, reporters, especially television reporters, to go through this. But when you came back home, and it could be just a regular day, but you are then immediately worried that, oh, you have spoken to this person, oh, you have spoken to this person, oh, you have spoken to this person. Am I going to put this person in danger? So there's a flip side to it also. And then you tell yourself, okay, sleep off, Sneha, morning will be fine, and you'll know it's just exhaustion. So that's how you literally take every day. And there's so many more aspects. We are still privileged. We are very, very privileged that we come from media houses that have the resources, that we even though in those times you're vulnerable, but there are so many um, regional reporters who are, who often are called contract journalists or stringers, and they are doing extremely vulnerable jobs without even enough backup or even payments on time. So that's another challenge. I just leave it at this, and you can, ask follow-ups.
So Mahesh, we're talking of challenges, and in the last few days, of course, the big thing that last few weeks actually, the big thing that keeps coming out is the underreporting that's going on in Gujarat. That the discrepancy that even you had, Mahesh. Mahesh, can you hear me? I think he's frozen.
Yes, yes.
Yeah. So the discrepancy in the figures between what comes out from the hospitals and what is being reported. Tell me, how challenging is it to report in this environment?
Well, in last June, government started, meddling with the data. Till June, they were fine with, they were giving data of patients dying of comorbid conditions, patient dying of, After June, they started meddling with the data, and it became quite challenging for us. But then first phase was on its kind of, it subsided, so it didn't make much of this.
Sneha, tell us, you said there is a sense of fear. Is there also a sense of intimidation from state governments, in Kerala or district administrations, where they feel, they're trying to hide figures, or they're trying to sort of not give the real picture for whatever reason? They may think they don't want to spread panic. But is there that as well?
Well, I think this is where the sources come into play as a reporter. Irrespective of what the state or the administration would feel, and across India, it's these are hostile times for reporters also to report. Hostile in the sense that you have many states where figures are convoluted, are hidden, they're not coming out the right way, and reporters are taking the challenge, going out there. You're seeing visuals and figures being matched from cremation grounds, and all of that is happening. I think this is where sources really come into play. There are those sources who trust you, you trust them, and that's where you really get your information from in many states. Where data, even if it's coming out officially, one, it may not be coming out officially. There are places, there are states in India where data is not coming out officially, but you still, as journalists, need to get those data out. And even in states where data is transparent, there are several underlying patterns that need to be figured out to be able to understand, what's the kind of extent of the spread, or crunch in manpower, or scarcity. And it's all here that really your sources, which you've developed over the period of time, that really come into play. And as journalists, I think I have admired journalists who have reported from many states, where even Mahesh is reporting, where it's extremely challenging to report.
We were, Mahesh, talking about the discrepancy in data in Gujarat, and I'm going to take you right back to that only. And how challenging is it for you to report in these circumstances?
So it's very, I was saying that the government started meddling with the data June onwards, June 2020 onwards. But by July, August, pandemic had subsided, and it was quite normal. This year, what has started happening, that we have thousands of cases. Today, Gujarat reported 40,000 plus cases and 170 deaths. Now, I take, every evening, late night, around 10 o'clock, I take data from civil hospitals of Surat, Ahmedabad, and 2-3 other cities. And that data I get, particular, data of, dead bodies that they dispatch for cremation. So there is a massive discrepancy, massive mismatch between the data that government gives in the health bulletin at evening and the data that we get from the civil hospitals and also crematory and burial grounds. I'll just give you one example. We have a very minor Christian population in Ahmedabad. The day last week, priest of the community asked the community members that now you cremate your body because we are running out of the space. We don't have space in our graveyard. So if that is happening in, Christians are very, very, it's negligible population in Ahmedabad. If that is happening to, that community, you can imagine what's happening around, in crematoria. We have more than 2 dozen crematoria in Ahmedabad. All of them are running 24/7. Same thing is in Surat. Same thing is in smaller districts, which are not even under media glare. We are reporting about Surat and Ahmedabad and Vadodara and probably Rajkot, but we are not, reporting about what is happening in Kutch,
Yeah.
what is happening in, Jamnagar, Porbandar, Junagadh,
Yes.
Chota Udaipur. So it's a completely mismatch between the government data and what you see on the ground. So I think there is when government gives you 150 deaths, I think it's 10 times more people have died of COVID than the figure
So
that
what kind,
government is.
you're talking about, Mahesh, the crematoriums and new furnaces that have been added. I've also been reading that, people have been asked to get their own board or they're to assess with the bodies themselves. And, there's a waiting period of hours outside. What are the scenes that you see there?
Sorry.
What are the kind of scenes that you have encountered there?
Oh, in you visit any crematorium in Ahmedabad, you have 5 to 7 hours waiting period. And that is, if you go to Surat, the waiting period is almost 10 hours. Surat Municipal Corporation, which had, has started 5 new crematoria in last 2 weeks, just to cope up with the bodies that are coming in for cremation. So, we have in local newspapers, we have advertisements from trust which run crematoria that we have run out of woods, please donate wood. So, now earlier people used to use ghee or, oil for cremation. Now they started using kerosene because so many of and when you use kerosene, body gets burnt quickly. So many deaths are happening. So it's very, very. I visited 2 crematoria in last 2 weeks, and it's a very, very, it's very upsetting, to be there. You can't even in Surat. I think last to last week in Surat, 10 bodies were cremated on one pyre. So you can imagine the situation.
We spoke to a doctor recently who said that currently we're on auto mode. And I want to ask you that also. Are you somewhere and there is fear, but is there also anger and frustration? And do you think there is that time that it will all come out?
Sneha, go with this.
Okay. See, in Kerala, the situation is very different right now. When I say that, we are reaching that stage where we are going to perhaps reach our surge threshold. We haven't reached the surge threshold in Kerala. So even as we are reaching the surge threshold in Kerala, you are now having a situation where hospital beds in private hospitals, ICU beds, they are getting filled to the maximum. They are running full capacity. Medical colleges are running full capacity. But even though we have not reached the surge capacity yet, you've had a system, you've had the administration and the government that has now that has taken this on war fitting, and before even reaching the surge capacity has gone ahead and decided to double the available ICU beds, say in government hospitals, reserve 25% of ICU beds in private hospitals. So these steps are being taken even before we reach the surge capacity. Now, this perhaps is a very important step, and we'll have to see how much of this actually works out on the ground to be able to see whether there's that kind of frustration and anger being seen in people and whether it will pent up that way. Right now, that's not the situation in Kerala, at least. Especially, you have a lot of people I have been speaking to who have tested positive, who are admitted at homes right now. They are saying they are getting calls from psychologists. They are as psychological counselors. They are getting calls from ASHA workers on the ground. They're getting calls from local police personnel. So these are the calls that they are getting on a regular basis if they are positive, if they are in quarantine. There are others who are saying they have not got beds, but I am not meeting a person who's in high vulnerability of C category or B category and has not got medical assistance. There are desperate calls coming up at hospitals, but there's a triad system in place where you categorize A, B, C, and medical assistance is prioritized for B and C category. See, at this level, Kerala has won a lot of, it's got the highest registered doctors to population in Kerala. It's got a very active PHC system. The ASHA workers, the Anganwadi workers, they've literally been at this for almost a year and a half. They have been the nerve center and the spinal cord for all of these activities that are happening on the ground. They are the ones who are mobilizing people for vaccinations. They are the people who are mobilizing people. They are the people who are in touch with people who are either in quarantine or in reverse quarantine or going to, who are positive, whether they need hospital. They're the first line of contact, and these systems are functioning on the ground for now. So right now, that kind of paralyzed system is not what we are seeing. It's a functioning system as of now, but we haven't reached our surge capacity, and we will have to see these. That's why I think when officials, when Chief Minister says that we are sitting on a volcano, that's literally what it means. It's the next 2 weeks which are going to be decisive for Kerala where it heads to.
No, Mahesh, you want to?
No, I just wanted to say, so Mahesh, the same, comparing the Kerala model, which is, preparing itself for the worst, to the Gujarat model, which is in denial.
Yes, Gujarat is completely in denial. Also, the fact that Kerala and Tamil Nadu focused on
That's
health
right.
education, whereas Gujarat kind of neglected public health to large extent in last 2 decades, and what is happening on the ground is a result of that. We have hardly any functional primary health centers at rural areas. Government probably thought that private healthcare sector will fill in the gap, and that will take care of the but that is completely, now private healthcare has come up in big cities like Ahmedabad, Surat, Vadodara, Rajkot, but private doctors, they don't want to practice in rural areas. And in government public health institutions, we have massive vacancies because they have not filled in vacancies for last 10 years. So we have two-tier healthcare system, public healthcare system, panchayat run healthcare systems like primary health centers and community health centers, and then municipal run health centers in the municipal areas. We have massive vacancies. As of now, 6,000 vacancies in panchayat run primary health centers and community health centers. Secondly, we have massive vacancies of doctors also, because the government has not filled in vacancies. So that is why the state is bearing the brunt. Civil hospital, Ahmedabad Civil Hospital, which is designated 1,200 bed COVID hospital. Today there are 3,000 patients. Patients are lying on the floor. Patients are lying on the you find a space and there are patients lying. One photographer of India today, very well-known photographer of India today, Shailesh Rawal. He died in civil hospital. He was at his residence, and all of a sudden his oxygen level dipped. So family made calls here and there, and he was personally known to everyone, chief minister, even prime minister, and every minister of the state. So family was asked to take him to civil hospital where they had arranged a bed. The guy died on the stretcher because there was 2 hours line, ambulance line for patients to be admitted, and he died on the stretcher.
So I've been hearing
So
that, Mahesh, that the government in many hospitals you can only be admitted if you're coming in government ambulances.
yeah, so you have very funny rules from either municipal corporation or from the health department. Now municipal corporation has made the rule that you'll be admitted only if you produce your Aadhaar card. Means in municipal run hospitals. Another funny rule is that you'll be admitted only if you go by this 108 ambulance service, which is run by the state. So now waiting period for that ambulance is almost 18 to 20, 18 to 25 hours. If you call now, you will get the ambulance after 18 hours or 25 hours.
So
So even for home testing, if I make a call now to for testing, they will come after 3 days to collect the sample.
So I'm going back
So
to what Monica had said, that is there like a lot of pent up frustration that is now coming out in anger, or is there complete resignation then?
there is pent up frustration, and also there is sense of resignation because people think that this is what it is. They have to deal on their own because there is hardly any government now, in the sense that people are even people associated with ruling party call journalists and others that please get us some injection or get us some medical ICU bed or something, emergency medical help. So system is completely stretched. They are saying that they have created a lot of additional capacity, but that's mostly on paper. I'll just give you an example. Our Home Minister inaugurated this DRDO setup hospital in Ahmedabad. It's 950 bed hospital that was inaugurated by the Home Minister last Friday. As of today, only 150 patients have been admitted because they have no staff. Hospital doesn't have staff. Hospital doesn't have other medical amenities. They just to make since High Court is very tough with the government and media is also quite aggressively reporting the situation. So they made that we have created 950 bed hospital, out of which 250 beds will be ICU and with ventilator. But as of today, only 150 patients have been admitted. And again, there 2 patients died in the ambulance because there was massive queue, massive, some 80, 85 ambulances were waiting in the queue, and there were police people were having arguments with the police and other security guards and other people. So you can imagine the situation that is there in the city.
No, I mean, it just
And, and,
sounds.
and sorry to
Yeah.
interrupt.
No, no, please.
Yesterday, Surat branch of Indian Medical Association, they pleaded to the Chief Minister, to the Municipal Commissioner, and to the District Collector that 4,000 patients are under treatment in 400 odd hospitals in Surat. If you don't supply oxygen to the private hospitals, we will be forced to discharge all patients. We are running out of oxygen. Surat city needs 250 metric ton oxygen. State is supplying 175 metric ton. So, Medical Association in their letter to the Chief Minister stated that there will be law and order situation in the city. People are arguing with us, our staff. We are concerned about safety of our staff. Please do something, otherwise there will be massive law and order situation in the city.
And that's already happening. In Delhi today, we saw violence at a hospital,
Yes.
where a family attacked the staff of a hospital because they couldn't get their mother a bed. And sometimes I feel we're living in unreal times. Could this really be happening? But to end this conversation of ours, I wanted to ask you, there is now, I don't know whether there are government trolls or there is some sort of, typical movement happening, but there is a lot of this to say, don't spread negativity. Why are you showing pictures of crematoriums? And really, if people like you, if reporters, I mean, I was a journalist for 24 years, if we didn't do our jobs, then and none of this would come out. I mean, these are stories that need to be told about the times that we live in. And as there was a reporter who said today that we don't really want to show crematoriums, but we have, I mean, in so many ways, this is telling of history. And I just wanted to ask both of you on that, as to what you go through every day, overcoming your fears, personal and professional, just to tell these stories.
Sneha?
Sneha.
No, I think Mahesh is there. Mahesh is going to, yeah.
Okay. Mahesh, please.
Okay, so it's very, as you said, we live in unreal times. You just one visit to a hospital where patients are literally lying on the floors, on the steps, everywhere actually, or one visit to the crematorium, any crematorium in the city, across the state. It's very, very painful, to see the kind of horror that you see. And let me tell you that government would not be bothered if we didn't run the, on social media, the crematorium visuals footage and hospital footage. Government would not otherwise be bothered. Now that's why they were using their people that, oh, now let's not be negative, let's spread positivity, and let's not show crematoria and stuff. But otherwise government would not be I think government is more concerned about what's trending on Twitter and Facebook and other social media platforms. Government is not bothered much about about what I will be writing in my report in the Hindu, or someone else will do some story on television, unless and until that story becomes viral on social media.
Sneha?
No.
Well, just a couple of things. One, this whole thing about don't do negative stories, don't do this thing is, we are over with this, honestly. We don't care. You can sing as many songs as you want to sing about this, whoever wants to do it, because whether it be from politics, whether it be elections, I still remember covering elections, and I think covering elections in Kerala over the last 1.5 years or 1 year, the only time I literally felt scared was getting into those rallies and reporting. And I used to put it out on my Twitter that what is happening, we will be heading into a second wave. But then it was all there, people, elderly people with their masks lowered or not wearing masks, going out onto rallies. And even that time, there was this whole thing, why are you only criticizing? There is this whole political rights and democracy and all of that. So anyway, we are done with that thing. Secondly, as journalists, it's literally about being people's voices. So if you're seeing only negative things, it's because that's what people are facing right now. If the administration, the government and people kept in, because if there are volunteers out there and if there are voluntary movements and people getting together in groups and helping, media is reporting that too. If there's government which is actually working and functioning, and there is a system which is delivering, the media is reporting that too, and reporting very, very happily. And if the government is failing, the media will report that too. So what is happening is exactly what the media is going to report. No one is going to sugarcoat anything. And thirdly, in terms of, the saddest thing when I report from Kerala, because this is a machinery which is stretched. Now imagine Kerala has the maximum number of doctors to population ratio. And yet, over the last 1 year, you had around 13,500 paramedical and medical personnel who were recruited. And now there's an appeal which has gone out again saying, please join, we need more people on the staff. On the ground, you have literally the ASHA workers stretched. They are, one of them was saying, now we've become gods for people because anything happens, they call us. So there is a system working on the ground and they have a capacity to increase vaccinations every day. And you don't have vaccines available. Here's a system which is saying we are ready to do it and you're not giving them what they can deliver to people. That is perhaps another tragedy. of denying people their basic rights when actually there is a system to deliver it. And then secondly, there are several other challenges like testing. In Kerala, you have government which is giving all of it for free, but how much can the government do? You also need private groups, and the testing there, the results of the government sector takes longer time to come. At the private sector, the tests are expensive. So this is something also which other states are facing. In fact, most of the states are relying heavily on private players. This is another thing which needs to be streamlined. Journalists have to report this.
No, I totally understand. And I just want to end, because I think we're coming to the end of our time, is that really more power to you guys. Keep doing what you're doing, because you're doing such a good job. Stay safe, stay healthy. I mean, you have families to look after as well. And just
don't sugarcoat
deep
anything.
gratitude.
Yeah, don't sugarcoat anything, because nothing needs to be sugarcoated, really, honestly. It is what it is, and it's pretty bad. So yes, as Manika said, I think we could have carried on listening to your, your ground reports, honestly, in a way. But thanks both so much for joining us today, Sneha and Mahesh. We hope to catch up in better times. And until
Sure.
then, stay safe.